Hello everyone, it's Schematic Med, and today we're going to talk about first type hypersensitivity reaction. As we already know, there are 4 types of hypersensitivity reactions. First one is anaphylactic or atopic, second one is antibody mediated, third one is with immune complexes, and fourth one is delayed one. Keep in mind that first, second and third are antibody mediated and fourth one is cell mediated. Type 1 or first hypersensitivity reaction, we call it anaphylactic or atopic one. So what I'm going to discuss today is going to be after sensitization of mast cells. So we're going to discuss what happens after second exposure of the antigen. Sensitization of mast cells occurs when exposure to the triggers leads to the production of specific antibodies, IgE antibodies. So we're going to talk and discuss a condition where the IgE antibodies are already preformed. In first type reaction, we divide immediate phase and late phase. Immediate phase occurs minute after second exposure with the antigen, and late phase occurs hours after second exposure. The main actor of type 1 hypersensitivity will be the mast cells. So inside the mast cells we can see lots of granules. In these granules we can find histamine, which is a vasoactive amine, tryptase. This is very important, that's why I highlighted it. So this is a marker of mast cell activation. So if we find tryptase, it means mast cell is activated, and leukotrienes. Keep in mind that this is immediate phase. In the late phase, we will find the chemokines. The mast cell will release the chemokines, so it will attract and call other cells. So we will start from immediate phase. So we can see the mnemonic here that I must be first. Mast cell is participating in first type hypersensitivity reaction. On the surface of mast cell, we can find these receptors that we call Fc receptors for IgE immunoglobulin. We already discussed that we're going to talk about what is happening after sensitization. So we already said that the IgE immunoglobulins are preformed. So we're going to imagine that allergen is a bee. So I'm going to use them as an allergens. So during immediate phase, antigen cross-links preformed IgE on presensitized mast cells, which will cause immediate degranulation, release of histamine, tryptase, and leukotrienes. We can see here that degranulation occurred and these granules, they are released. So this was the immediate phase. So right now let's talk about the late phase, which will occur once again hours after second exposure with the allergen. During the late phase, mast cell will release a chemokines that will attract inflammatory cells, for example, eosinophils and basophils. Please keep in mind, very important, eosinophils, basophils, and mast cells. So that will cause an inflammation and tissue damage. It can damage the invading cells and host cells. So right now let's talk about the examples. So we already said that anaphylaxis is first type hypersensitivity reaction. The causes can be food, drugs, and bee sting. And of course allergic asthma is first type hypersensitivity reaction too. And last but not least, we're going to talk how to test these patients. So we can do skin tests and blood tests. So here is a very good depiction from the internet, the skin test. I think you're familiar with this. Or blood test or ELISA test that will help us to find allergen-specific IgE antibodies or specific antigens. We're going to talk about this laboratory technique very thoroughly. ELISA laboratory technique. ELISA means enzyme-linked immunosorbent assay. We divide it into direct ELISA and indirect ELISA technique. During the direct ELISA laboratory technique, we want to find specific antigens, and during the indirect one, we want to find specific antibodies. During direct ELISA, we attach antibodies to the microfiber plate. Then we add a blood sample that we want to examine. If the blood sample contains the specific antigens, it will attach to the antibodies. Then we will add a labeled antibody, and if there is an antigen, it will attach to the antigen. We can see that there is an enzyme that is attached to the antibody. So when we add colorless substrate, if there is an antigen and the antigen is connected to these two antibodies, then the substrate will change the color. So we will visually see the color change, and it means the test is positive. During indirect ELISA, we attach to the microfiber plate an antigen. Then we add a patient's blood. So if the blood contains the antibodies, it will attach to the antigen. Then we add second antibody that is labeled with the enzyme. And after that, we repeat and add the colorless substrate. And if the color is changing, it means the antibody is present. So there is one question, why we need to complicate everything like that, and why we need to add two antibodies if we can add only one. So during the indirect ELISA test, the use of a secondary antibody amplifies the signaling and making the assay more sensitive. And indirect ELISA allows the detection of multiple antibodies in a single sample by using different secondary antibodies labeled with distinct enzymes. Thank you very much for your attention. Bye.